Now it's captured pictures. Okay. All righty, folks. Well, welcome to September's Behavioral Health Subcommittee meeting for PCCEP. I'm glad you're all here to have conversations about the future of this committee. I want to hear ideas, meet the new members and have a good old conversation of some formatting around creating a mission statement for our subcommittee. Because there already is a mission statement for PCCEP, but I really want one for the subcommittee, and I need everybody's help. So we're going to start off the agenda with the reading of the PCCEP values. Claudia, do you have those available?
All right, welcome everyone. My name is Claudia. I am the project assistant for PCCEP. So let's go ahead and share the values of PCCEP. And I can share them on the screen as well. So let me do that so everyone can get that visual of them. All right. So these are the PCCEP values that we recently revised this year. The first one is listening effectively and respectfully, share airtime, be present and open to new information and perspectives, assume positive intent, respect each other, respect the group, speak your own truth, communicate directly, honestly, and respectfully, ask questions to clarify, call out bias, and be okay with ambiguity. Sorry, can't pronounce that word. And then we would just also like to remind folks that if there's any like Zoom bombing, we will take care of that. We try to just immediately remove those folks and report that. And also if there are any questions, we just ask for folks to wait for the public comment period. And if you do have any questions for staff, feel free to reach out to me or Judith. Thank you.
Okay, great. Now we're going to move on into introductions, and I like to open the meeting with an opening question. And tonight's question to ponder about is, what superhero do you connect with? And if it's not a superhero, that's fine. What individual do you connect with, and a little bit of maybe why? And so, for me, I guess my superhero is still going to be Superman, because I do believe that everything is possible. And he always made me believe that no matter how hard we work, we can have our dreams. So I'm going to go with that superhero. So I'm going to pass the ball or the baton to Tia. Give you a little, we're going to play popcorn, where we just pick someone when we're done.
Okay, that's a really hard question. I haven't thought of a superhero yet, but it would be someone that's determined, and even though they've gone through obstacles, they really want to prove themselves that they have the strength to move through any obstacle. So a determined person. That's the only thing I can really think about.
That's a great answer. Thank you. Yes. Okay. Who would you like to pick?
Oh, let's see. How about Jared? Jared. I don't see his picture though.
Hi.
Hi.
I'm in my car, but I'm not driving, so I can use the video feature. I think the question is to name a hero.
I guess we call them superheroes or whatever, whatever you're connected with that gives you a sense of, like strength or whatever. Mine is Superman or Superwoman, either one.
Yeah, my personal hero is super in a lot of ways, but not in the X-Men way. I clerked for a judge who works on the Ninth Circuit Court of Appeals. His name's Ron Gould, and he's been living as a paraplegic with multiple sclerosis for a couple of decades now. He was appointed to the federal bench while in a wheelchair, and he was the first to be so named. I had the honor of working for him in 2004, 2005, and he's been a source of inspiration and strength for me as a lawyer with a disability to see someone like me at the height of the profession, one step away from the Supreme Court. So I draw on Judge Gould's strength and wisdom and experiences often in my life. And I would consider him not only a role model for me, but also a hero of mine. Thanks for the question. And I will pass it to Lieutenant Hetman if he hasn't gone yet.
Hey, everybody. I can't say the whole meeting, but I'm happy to be here just briefly. I'm the lieutenant that oversees the behavioral health unit at the Portland Police Bureau. I kind of chuckled as the question. I think when I was a kid, I had an affinity for Inspector Gadget, and if people aren't aware, is a cartoon character that was able to be very resourceful and come up with unique ways to solve problems. And I feel like that's been my life for the last little bit at the Police Bureau, and just in life in general. So happy to be here, and I will pass it to Barb.
Oh, wow. That last one opened things up for me, but I don't have enough time to think about it. My name is Barb. She, her pronouns, member of the committee, not a member of PCCEP. And what came to my mind was ISIS. And I'm not sure if it was just because she like spun around really fast I'm not sure what it was, but I really liked ISIS. It might've been just the long hair. That's what I got. And I'm going to pass it to Chase.
Hey everybody, my name is Chase Bryson. I'm the Crisis Intervention Team Coordinator at the Police Bureau and work up in the Behavioral Health Unit with Lieutenant Hetman and Sergeant Myron, or for Lieutenant Hetman and Sergeant Myron, maybe more appropriate. I was never really into superheroes as a kid, which I guess makes me odd maybe. But what I think is somewhat cliche maybe is I guess I like Batman because he actually didn't have superpowers. He just was like a normal person who was ultra creative, and so I kind of like that idea. And I will pass it to Sergeant Myron.
There I am. Hi there. I am Steve Myron. I'm one of the sergeants in the Behavioral Health Unit. I don't know that I have a superhero that I like idolize or relate to, but I will say that as a small kid, my favorite superhero, and still remains today, has always been Spider-Man, because he was just a teenage kid that got powers, and being a kid myself long time ago, he was the one that I always idolized. So that's it. And I will pass it off to Byron.
Hello, my name is Byron Vaughn. I guess a superhero would be Wonder Woman, but my true superhero is Sidney Poitier. I was a kid, I watched Racing in the Sun. That was the first movie that ever sat me down. That was a black and white movie that held my attention throughout the whole movie. And he inspired me watching that movie. I don't know who is left. Patrick?
Patrick. Hold on.
Patrick.
I was never a superhero guy. I was a big fan, I'm still a big fan of Robert Helvey, who does a lot of thinking on strategic nonviolence. And yeah, I like him.
Awesome. Thank you, Patrick. I think we still have Giovanni. Is that how you say it?
Angie.
That is how you say it. I'm not a member. I'm
That's
here
okay.
just
We're
watch-
all
Oh, okay,
sharing.
okay,
Yeah, we all share here. Yeah, it's it's
okay.
a family thing. We try to.
Okay. I would say Captain Marvel. Because she is a kind of no nonsense, what needs to be done, let's just go do it and get straight to the solution type of person. And that's how I believe I am. And I like that attitude.
That's good. I like that one. Yes. Okay, I think we have
Yep.
Judith left. And
Did Claudia introduce herself? Hi, everybody. I'm Judith Mowry, and I work at the Office of Equity and Human Rights and help support this group as staff. And I also was not a big superhero person, although I've now seen so many Marvel movies because my daughter-in-law loves Marvel, so I am like getting much more up to speed. But I like the so only because of movies, I like Thor because I just like the way that character is played in the Marvel movies, where kind of a doof, but really a good-hearted guy and a lot of strength, but also a gentle heart. I guess that's what I would say about that right now. And also, we do Barbara Boczynski?
not yet. There's a couple other members on here who haven't gone yet. There's
Okay.
3.
Okay. Well, I was never into really superheroes. But I have to say, I was raised Catholic, and I liked Saint Catherine of Siena because, like all the other Catholic women saints, she cut off her hair and refused to get married, and she told off the Pope. She walked all the way to Rome and gave him a piece of her mind. So I like her. Yeah.
That's good. Okay, I'm sorry, I don't know how to pronounce your name. SLOURENCO. Help me.
Yeah, I'm sorry. I see that. I got to figure out how to change that.
You right mouse click on it, and I think it says rename.
Yeah, I don't have,
go into view and rename.
yeah, I don't have a mouse. That's part of the problem.
Do it.
But
I think I just guessed. I'm sorry.
I'm Stephanie Lorenko. I'm the public safety advisor for Mayor Wheeler, basically Robert King's replacement. So I'm going to try to fill in for him and carry on where he left off.
Welcome. Awesome to have you.
Thank you.
And your super person or your favorite person, maybe?
Oh, I always thought Bugs Bunny was kind of my superhero because, every Saturday morning sitting on the floor, the console TV, keeping the volume low, not to wake up anybody, but Bugs could never be defined by one thing. Bugs did everything. Bugs was superheroes at times, and Bugs was, just you couldn't put Bugs Bunny in a box. And I just always thought that kind of freedom and joy was really admirable.
That's everyone.
Wow, that's wonderful. Anika, you haven't gone yet. I noticed you
Anika
popped
just snuck
in.
on.
Yes.
Hello, good evening. Yes, sorry for the delay. I believe the question is superhero, right?
Yes, and if that doesn't fit, pick someone you're connected with. I'm open to, that's just my term, but I'm open to whatever people have.
Oh, for some reason, when you said super, I think of the Bionic Woman. I don't know if she was a superhero, but I definitely like that she activated herself and was seemingly like normal. But then when times were in crisis, I just remember watching the show as a kid. And the music, the background, I like that. Sometimes I think of myself doing that. Anyway, that's it.
Good image, Bionic Woman. Yes, that's a good one. That was a good one.
Thanks.
Well, thank you all. I think I got everybody. If I missed anyone, let me know. But I think everyone reported out. Thank you. Next, we're going to do a welcoming of our new members. We have some new members here. Judith, can you help me? Is everyone here that?
Well, Tia, is a
Tia,
new PCEP member, and Byron is a new PCEP member as well. So we're really super excited. They just got they've just been seated, so they're brand new, and it's great to have you here. Tia, you've been coming to a lot of meetings, and Byron, it's fantastic to have you be a part of the meetings as well. Did Claudia go? Did she have her superhero in her name?
I didn't hear her.
I did say my name when I pronounced or when
Yeah.
I shared the values, but I can share again. Again, my name is Claudia. Claudia, I'm the project assistant for PCEP. Thank you guys for being here. I don't really have like a superhero. I guess Spider-Man, because my nephew has watched the movie like a million times, so I've seen it so much, and he's actually pretty cool. So yeah.
yeah, if we could only do what he did out of his wrists, right, and go through traffic, we wouldn't have to worry about getting run over. Little joke, sorry guys. Alrighty, well, in that case, I'm gonna give each Tia and Byron, is that right? Visually, yeah. We're gonna give you each a little bit of time to kind of introduce yourself, let us know why you're here, and maybe some of the goals you'd like to see achieved through this subcommittee. Because we're always interested in hearing from other folks and their ideas. So Tia, would you like to go first?
Okay, sure. I wrote a few things down because I had a prompt, which was helpful. But I retired from school counseling in Eugene, Oregon, after 25 years and moved to Portland and was really seeking community. And I got connected with the unhoused community really quickly because of my sister. And so I started volunteering in 2017 when I moved here for Rehab Sisters. And I'm a very diligent and regular volunteer and getting more and more involved with the unhoused community here in Portland and understanding the different aspects of homelessness here in Portland. Just a lot of learning we have the Multnomah County Needle Exchange in our parking lot, and we work with Multnomah County Harm Reduction Program with the Needle Exchange and sex trafficking and sex workers and the in-house community. And there's just so much to it that I'm learning all the time, and I still am learning and want to be more involved and help them have a voice, because they're the group of people that we have coming, I feel, are very marginalized and not heard. And I'm hoping to, I've heard them talk a lot of stories about interactions with the law enforcement and just the public in general and how they feel. And I want to listen to them and share out when I can. Also, when I moved up here to Portland, that was a big change from Eugene. I was very connected with Lane County Mental Health, Lane County Public Health, and I just really wanted to get more connected. And so I kept searching. And then all of a sudden the protests started happening in Portland, and I was really concerned about the racism and the violence that were coming along with the protest. After finishing my own Center for Equity in Education, where I learned about my own biases and implicit bias, helping our kids in education be included, like more inclusion and having more equity in schools. And after my 100 hours of training in CFE, I felt why wouldn't a police force be in those kind of regular, we had it every 3 months, we had to do racial equity trainings. And I felt like that would be a really neat thing for the police force to do, is to really have that kind of training where they learn their own biases and just a lot more about equity and inclusion and diversity. And I really want to speak about that. And I called the city of Portland wondering what I could do. And they transferred me to Theo. And so that's why I got involved with PCCEP. I just really wanted to do something, and I really like being involved in, let's see what else. I really like being involved with the community that I'm in, and I always want to be a fixer and be part of a team that comes up with solutions. What is the name of the organization? I just got a question on what is the name of the organization? Rahab Sisters that I volunteered for, or the training that I did was CEFE, Center for Equitable Education.
Oh, the Rahab Sisters, how do you spell that?
Rahab's like the lady in the Bible. It's RAHAB'(S) Sisters.
Oh, Rahab. I guess I never heard of her. Okay. Maybe that's a superhero.
Yeah, Rahab's in the Bible. She welcomed all sinners to the table. So she was different from other women in that era. And so the person who, from the Episcopal Church on 82nd Street, wanted to invite all people to the table and feed them and help them and provide food and needle exchange, and a lot of things started happening on 82nd Street. Our program is on 82nd and Ash at St. Peter and Paul's Episcopal Church. And there has been a police presence there with our needle exchange is in Multnomah County. Needle exchange is in our parking lot through Multnomah County harm reduction, their van. And in the past, we've had police sitting across the parking lot, kind of keeping an eye on things, but it really made our guests nervous. And we had a lot of discussions around that in the Montavilla neighborhood. I wasn't a big part of that because I'm not a leader there. I just was hearing what was happening and trying to listen to the guest.
Thank you, Tia. Hey, Chase, question. Is there a officer that heads up the sex trafficking division? Like, where is that sequestered into? What department?
There are, and Lieutenant I might have it more, but I think there's 2 sergeants, and I don't know if there's 2 right now because of staffing. Sergeant Foxworth, and then he has at least a couple officers, and it's human trafficking.
Oh, human trafficking. Okay.
It's up in the, I think they're up in the detectives division now.
Okay, because, you know, something just clicked in me is that if we have folks who have, you know, like different areas of work or concern, and we meet the folks, you know, that are operating those departments, it puts a face to, you know, to a name like we do here with you and, you know, and everything. And that's something I think is important, is to build and expand on our relationships with other department leads, you know, especially for a lot of folks who are working some of these intense environments, you know, it's really good to have help. So maybe in the future, we can have a conversation, Tia, with the way the programs operate or the way the, you know, services are provided, so we can start building more relationships with folks. Does that sound good?
Yes, I would love that.
Yeah, and then you can probably bring your people in and we can have a really robust conversation. So yeah, think about that. We'll get some folks lined up.
That would be wonderful.
Yeah, thank you. Byron, sorry. I guess, would you like to go next?
Hi, my name is Byron Vaughn. I ran into PCCEP getting emails from the city about different meetings that were going on. So I just kept track of it. I moved up here in '94 from California. I love it up here. I wouldn't change anything. My whole goal here is to hopefully have a say-so in how mental health plays a part in gun violence and the upbringings of community, especially in the Black community. And that's my focus. And hopefully my teachings can reach everybody that isn't of color, because I don't discriminate. I'm an equal opportunist. I give everybody a chance. I have a lot of things that I've written down, so I kind of want to get the ball rolling because, and I don't want to, I guess I can show you more than I can tell you as we go along with these meetings of who I am and what I'm about. So thank you.
Yeah, that works for us. It works for me. I like going slow. Bring it on. Yeah. Okay. Well, some of the things we're trying to figure out and plan on is what is our meetings going to look like in the future? What direction does everybody want to go? And what are some of the important points that folks have that they feel like they want to bring forward now around the settlement agreement, around some of the areas that we continuously work on, which is mental health, behavioral health, crisis response, and things of that nature. Okay. So does anybody have any ideas on what you'd like to see this committee achieve in the future? I don't want to set a timeline, but
I can raise my hand.
anybody out there?
First.
Tia has her hand up.
Oh, okay.
And then
Go
Barb.
ahead, Tia, Barb, either one.
Okay, after reading a few different documents, looking through missions and the very first meeting that you all had, how we took over the Community Oversight Advisory Board. This is just a general statement and then I'll move forward, but I just kept noticing so much language around communication, meaningful engagement. A public could provide their input, exchange information, community engagement, concerns must be heard, input, conversations, community conversations. And so I'm hoping that we can really listen to those community concerns. I know I'm new and this team has been happening for a while, but so far I've been really learning about the PPB and what their trainings are. And I really love that. And I want to know more. And I think it's really important, but I would hope that there's a balance of learning from the Portland Police Bureau, as well as getting information from the public and how we can bond the two together. So I like conversations and communication, and I would hope that I can contribute to that.
Thank you. That is wonderful. Okay, Barb.
Hi. I'm going to say that this committee has been together for just over a year. And I want to remind people that there are video recordings on the YouTube channel of some of the educational things we've done in the past. And that for the next thing sort of like on the agenda right now is to finish up what we started with the wellness and see if there's, the wellness program for the police, and to see if there's any recommendations that we want to put forward. So I just want to make sure that that doesn't get lost. And after that, I am like so with everyone to help whatever wants to happen, happen.
Thank you, Barb. Patrick, what would you like to see out of this committee?
I'm just here to listen to Jared.
Just to Jared? You don't have anything to bring the committee? All that work you did here before?
No, I'm sorry. I am right in the middle of eating dinner and I'm kind of multitasking. Sorry.
Okay, that's fine. Yeah, Jared, go ahead.
Well, since Patrick wants to hear my voice, we shouldn't let him down. From the Department of Justice's perspective, and I'm speaking with that hat on, not my individual hat, there's a couple of, goals, I guess, that we have for the entire PCCEP, which can trickle down to any committee. And one of those is to, have recommendations for the Police Bureau to improve its the community of people who identify as having a mental illness or who have loved ones that have a mental illness. So to the extent you guys have recommendations, we would love for you to explore those. Of course, we've not put any mandate on what the committee does, so we do defer to what you all think is important. A couple of things that are mentioned specifically in the agreement, though, is one, the community engagement plan that the Bureau adopted with your input and the broader PCCEP's input. I think that was adopted 2 years ago now. It's been updated once, and to the extent you guys have feedback on that or an assessment of how the city is doing or the police bureau is doing on their community engagement plan, that's always helpful for us to understand, how you think and how the community thinks the Bureau is doing with its current community engagement plan. That's an assessment as well as what you could do better, what maybe you should do differently or stop doing altogether. And I think the last thing I would mention is that there is an obligation to PCCEP to independently oversee the implementation of the settlement agreement. With respect to this committee's focus on behavioral health, I think that would, call into mind sections 5 and section 6 of the agreement. That's paragraphs, 88 to about 115. We found substantial compliance with all of those paragraphs as the Department of Justice. We're not infallible, though. We take input and recommendations. If you want us to revisit, something, we will revisit. One paragraph that comes to mind is paragraph 90D. And what that speaks to is an obligation for BOEC, that's the 911 call operators, to expand their capacity to divert calls, mental health related calls, to a non-police response. And that's obviously Portland Street Response. It's the Multnomah County Crisis Line. BOEC and the city have done several things. If there are other ideas for how the city should divert certain calls away from a police response or an armed police response, we would appreciate hearing what this committee and what the broader community think about that. That's a continuing obligation for the city through 911 to expand its capacity to divert calls away from an armed response. And that's, a pretty good way to avoid some tragic outcomes, with situations escalating out of control or spiraling to the point of, a use of force or a higher level use of force than might otherwise be needed. And so, that's an important part of the settlement agreement, is for 911 to divert calls away from a police response when that's appropriate. There's a lot that goes into that. When is it appropriate? Who's the diverting entity that gets those calls? So all of that, I think we would appreciate yours and the community's broader expertise to weigh in on recommendations for that. So that's my 2 or 3 cents. But ultimately, it is up for the committee to self-determine. I don't direct the committee at all. I have ideas if you want to talk about them.
I had a question. How far are we looking for a solution now, or is there some way we can start before the call is made, like some mental health, encouraging neighborhoods and people to, if they see something like this, they can go to somebody trustworthy, where if a guy has a gun or something mentally problem with him, he won't go to jail. Nobody will know it. This is all confidential. So I'm not before I say anything or speak out of turn, I'm just trying to feel my way through what has already been spoken about and where we need to go then.
Yeah, that's an interesting thought process, Byron. I mean, as far as I know, Barb is going to talk about a new system coming online that is going to be another route to direct calls to. So I'm going to let her explain it. And then we'll get back to your question because it's really important. Go ahead, Barb.
Sorry, Byron, it's just maybe a continuity thing. Jared, do you remember we talked about 988? I don't know if we've talked about it in here or not, but
I think you mentioned it once or twice in here, but we talked about it separately.
Okay, well, so I think that should be wriggled in to this part of what you're talking about with BOEC. And sorry, people, what I'm trying to talk about is there's a federal mandate, a federal law that by mid-July next year, that every state is to have online a suicide prevention helpline. And OHA, the Oregon Health Authority, the people that run Medicaid, the people that have been doing the vaccines more than they thought they would ever have to do, are in charge basically of more or less the 988 system for the entire state of Oregon, which would include the Portland metro area. So this number is going to be 988 rather than 911. And the hope definitely here is that there's a goal to not just make it for crises, not just make it, for that last minute, crisis kind of thing, but to make it pre-crisis and have there be resources available for anybody that calls about themselves, calls for somebody else, etc. I think I'm making that clear. If I'm not, somebody shake their head. Okay, everybody froze. Never mind, that didn't work. I can't see a screen.
Everybody's there.
Okay, I guess if nobody has any questions and everyone gets it, we should move on to what Byron was saying. Yeah.
And I just wanted to jump in and say Byron's thought is perfect and excellent. And if you have, it all starts with the 911 call. If you can divert a community member away from calling 911 for an unwanted person in their yard or some other low level call that doesn't deserve a police response, I think that's a great educational piece. And I don't know how to do it, but I think it's entirely appropriate for this committee to think about ways to not even have a 911 call, whether that's 988 like Barb's talking about or something else that Byron might have in mind. So Byron, I really appreciate that thought.
Amy?
Tia's hand is up, Amy.
Who? I'm sorry, what? It's hard for me to see.
Yeah, Tia has her hand up,
Go
and then
ahead.
Barbara Bochinsky does as well.
Excellent, thank you. Yeah, so everybody knows I'm a little sight impaired, and so I can't always see everything. So it's good to have, so if I don't call on you and your hand is raised, I'll have Judith help me. Thank you. Go ahead, Tia.
I just had two questions. One is, I saw that part of PCCEP's job description was to have on a quarterly basis, gather input from Portlanders regarding experiences with the Portland Police Bureau community and outreach. Are we still doing that? And the other question is, when I read through the paperwork on the application, I really thought that part of PCCEP's job was to go meet with a person after they had a police interaction. Is that, or an incident? Is that true or no? Did I make that?
Yeah, I don't think that, it's not part of the PCCEP person's job to have a contact with someone after the interaction. So that part is a mistake, is not quite right. We are supposed to have quarterly town halls, and those we ended up having a lot of town halls last summer during the protests. And then the PCCEP had taken on the additional assignments from the mayor's office of doing this project on the core patrol services, and then also researching truth and reconciliation process. So those got to be a lot of additional meetings as well. So I would say we have not had traditional town halls during the, during COVID in the last year, but they are supposed to happen. If
Okay,
any of you want to jump in,
thank you.
Who is next? Who has their hand up next, Judith?
It was me. I just want to say that back in the 90s, in the 70s, when they were first talking about 911, a lot of people, when they were first instituting it in San Francisco, people were concerned that it went to the police first. And so I'm very happy to see that there's now an alternative. So not everything is seen as a police matter. Thank you for coming, whoever's working on that.
Idea too. So I can sit here and come up with ideas all day long, but some of my best ones, and one that Jared bringing up BOIC is reminding me of, and BOIC is our 911 and non-emergency dispatch center for the city, basically. And it's around language. And it's around the language that's being used. I'm going to take a second here to let you guys know that before Portland Police turned, they used to be on the police scanner, and now they are no longer. I used to listen to them all the time. One of the things, for about 2 years, one of the things that I noticed, all of a sudden one day, the BOIC dispatchers' language changed. They used to refer to somebody who was having mental health issues, behavioral health issues, in crisis of some kind, maybe just acting a little weird, as 1234. And to refer to people by numbers, to me, is one of the fastest ways to dehumanize somebody. So I was like really, really thrilled that they made that change. But now when I still listen to dispatch, I just get to hear fire and EMS. And before that even, there's some language that's used that I think it would be really awesome if it changed. And I'm talking about using the term transient instead of all kinds of other nice things that can be said. And I'm more than happy to provide examples if need be. Transient is one of the main ones. I can't tell about consistency between using behavioral health and mental health, but definitely there's dispatchers using that. But those two are my quickest, best examples. And I think it's something that would be really cool if we could write a recommendation around. And I think that it directly has to do with the settlement agreement, from the standpoint that maybe it'll help outcomes if we're humanizing the people that the police are interacting with, rather than them just being bad guys.
And on that note, Byron, are there concerns or things, ideas that you have around how to communicate, or what kind of person do you think would be necessary to go out on a response where, things are happening where you don't want police? Like, what qualifications do you think folks would have to have in order to do the kind of thing you're talking about?
Understanding of oneself first and what they're held to, because you have to have structure, discipline, and you definitely need to be cool under pressure. Experience of everyday life. I mean, life experiences have humbled me. I mean, quite frequently, all the time. So to answer your question, I guess in some way, somebody that's in the neighborhood, somebody that has experience as always, and and I was thinking people don't know how to deal with crises when they deal with it for the first time, and if we could start there, and I don't know if this is a recommendation, with families and family members and giving support behind family members who are dealing with this for the first time because they feel like they're freaking out or don't know how to do it.
There's supposed to be a whole department.
Violence is not an option. Killing somebody is not an option. And I think that needs to be pumped out there into the community. I mean, we can't control TV and what we see. Yeah, we can't control what, if we're here at home, we can control, hey, man, killing is not an option. If you have a mental crisis, we have a number before we have to call you with a gun in your hand. That's, I want to try to get there. And I hope I'm not rambling.
No, it's great. I love it when I hear new ideas because it's there was a group that used to be in Portland a long time ago called the Guardian Angels, and they didn't pack guns and they worked as a team and they went out on the streets. I remember them because back in the day, there was a lot of drugs pumping on the streets and a lot of crime, way worse than it is now. And they were just there as a presence, as a group to try to make connections between the community and the police and not having the police come. And they did amazing work for the years that they walked the streets. They basically walked the streets through the hours that were the most critical and worked with the citizens and worked with the police. And I've asked them to come back. They're still in Portland, but they're not working anymore like they were. And I've asked them to come to meetings and kind of let us know a little bit about what the work is they're doing. But that was one group that really, impacted me. And then there was another group of folks that rode the bus, and they wore green uniforms, and they were on every major bus that had like major gang problems, gun problems, drug problems, and they were just there to make sure everybody was safe. And their presence kept certain bus lines safe, like the number 4 that used to run out to St. John's and the number 75. Those are really dangerous buses, and they did enormous work in our community, and none of them packed any guns. So I've seen examples of different groups, but I don't know what's available now because it's kind of slim since COVID came, but I don't see, a reason why we can't resurrect something.
I'm sorry, rider advocates, they were called. Go ahead, Byron.
Rider advocates. Thank you, Judith. Yeah.
This is just to see if it sticks. You can grab 5 families out of a neighborhood and you can make a perimeter of where they, not necessarily patrol, but, have a look over, they don't have nothing on, they're not marked, they just walk your dog, your family, your children. And that's the type of way you want them to think. Yeah, you're observing your neighborhood. If you can find families that can do that. And support is very big in this. If somebody doesn't feel supported, they're not going to really want to give you your all. So, and also another thing is that honesty. There can't be no talk about somebody else's business, because I'm sure a lot of people who go through this are embarrassed and they don't understand it themselves. And I think a lot of humility can be cut out if you come there with a true heart in helping this person in this situation. Maybe a person that's got a mental health problem, all he needs is a good job or something that he loves to do, and if somebody can direct him in that different direction, because a mental problem needs help with a doctor. Or if I had a problem grabbing bananas all the time in Safeway, somebody would say that was a mental problem. So I would go in and go get help. And then with that help, you want solid background. And you say, hey, you're going to be doing this. we need you to, there's going to be support for you all the time, if that makes sense. I'm sorry.
No, it's great. It does. And I just, because you don't really know me, I work with a hardcore team on the streets of Portland, serving 40 of the most quote unquote dangerous / intense folks that have high needs and, criminality and all that. And so I totally understand what you're saying, but the situation in Portland is kind of dire. And services are basically available to anyone in Portland who is like low income. You can get plugged in with an organization. But what I find is a lot of folks don't want to go to doctors. They don't want to be seen. They don't want the kind of help that we're offering. And we need to find another service that is more conducive to, like you said, to the neighborhood. Like, community health workers is what I think the title is, of the folks that do a lot of community work around families and stuff. So there's a lot of different variables here with your requests, because the medicine is all tied into insurance. Everybody has access to mental health care if they want it. It's just a lot of folks don't want it. And so, because they've been mistreated so bad in the past.
And that's the whole part about it.
Yeah, if we can work out a way to have a team of people do, like, we even have street outreach available. We have all kinds of outreach teams that go out into the neighborhoods, but it's having folks that we can make connections with, and that takes time. So I just want to say your idea is great. And I'm still working on trying to figure out how to make it happen in my world, to have more people checked in on and watched over and kind of looked after without all the police involved. So keep coming up with your ideas. We'll work together. And then NAMI, have you heard of NAMI, Byron? Okay.
No.
All right.
I was wanting to say, interject real quick. I'm sorry, Barbara. Maybe we need to start down when they come out of jail, and start pumping this into their brains and letting them know, and being behind them, somebody that can follow them, like not necessarily a caseworker, but I mean, because telling mental problems, not somebody, like I said, people are embarrassed by it. So how do you conquer that embarrassment to make somebody come out and be truthful with themselves?
Yeah, well, when they're coming out of jail, they always have a PO attached. They never leave there without one.
And see, he can't. The PO can't be looked at as a bad person, and the PO has to change his outlook. He has to change the way he looks towards this person that's coming out of jail.
Exactly.
It's a big pot, and you want something right now.
Yes.
And right now, only thing you could probably do is something. I would say, literature, changing the literature in some way, and somebody that's already doing this job, you might be giving him something extra to do, or maybe not, or maybe the city could speak to the state to open up another position or two, and somebody that can be truthful and is not going to look at somebody with objective eyes when they're coming out of jail, or they're coming to you with this problem. Exactly. Go ahead, Barbara. I'm sorry.
Go ahead, Barbara.
No problem, Byron. You said a lot of good things. I just have know people with mental illnesses who have been made worse by the drugs they give them. They get a 15-minute appointment with a psychiatrist once a month. And sometimes if they have a problem, they add more drugs, and people actually do better a lot of times when they get off the drugs. Maybe they get on some marijuana, like somebody, her parents, she's a young adult, and her parents got her on a particular type of marijuana that they researched. My brother's brother-in-law went to the VA hospital in Central Oregon, and every time he went there, he got completely worse, and eventually he committed suicide.
Ooh.
So I think, and then plus which I heard at the previous behavioral health subcommittee, they were talking about how, I think somebody named Tim, he was talking about how sometimes people throw away their meds because if they're on the street, they could get robbed for the meds, or the meds make them so dopey, they could get attacked and can't take care of themselves. So then it's like, wow, what do you do? So
Exactly.
it's not like people are just refusing treatment. It's like the treatment doesn't always work. And so
Exactly.
that's the issue.
Yeah. Thank you. Well, that leaves us, with a lot to think about. Hi, Mary Claire. Glad you could join us. I see your name popped up.
Hi there. Jared has his hand up as well. Sorry, Mary Claire.
Go ahead. Who? What'd you say, Judith? Sorry.
Jared has his hand up, but I'm
Okay.
sorry, I didn't mean to step on Mary Claire.
Go ahead, Jared.
And I don't mean to step on Mary Claire either if she has a superhero or something else to share. What I wanted to mention is, a lot of this conversation is, I just wanted to mention that a lot of this conversation getting at the root of, repeat contacts with law enforcement and folks who are having trouble staying on their medication or being in conditions that are conducive to avoiding future police contacts. It harkens to me to the service coordination team. And I don't know if there's a recommendation to be built out of that. But we found that team has been very successful in having a proactive solution, even though they're a secondary response to helping people avoid future police contacts. They save boatloads of money, according to a study done by Portland State University. I don't know if that program would get similar efficiencies or economies of scale by doubling the one person who currently is in the role or, building that out. But that's something that you might want to explore. And maybe Chase could speak to the work of the service coordination team and how that
who he's referring to. I understand that now.
Barb and Amy, we can hear you.
Yeah, Barb, go ahead.
To say that we already, we've heard from Emily Rochon in a previous meeting, and we can figure out which one it is if anybody wants to see the recording of it.
Yeah, go ahead, Chase. Do you have any information?
I have a few things. One, I'm certainly not an expert on the service coordination team. Emily obviously is by far the best person to talk about that. At its core, just for those, I know a lot of you already know, but their goal is to work with people who are homeless, have frequent police contacts or kind of chronic criminality and addiction. But the belief is that their addiction is fueling that kind of cycle. And they have an awesome program that comes with housing and all these supports. It's pretty intensive, and if people mess up and have to leave, they welcome them back when they're ready to come back again. And I get to see and hear a lot of the awesome success stories that come out of the work they do. So it certainly is something that there's a lot of value there in what they do. And I just wanted to say, and I've kind of just been listening and agree with and think a lot of the ideas that people have said are great. And certainly you're voicing a lot of the frustrations or barriers that we encounter. When I was working in the behavioral health response team with a mental health clinician, and some of the people that have those frequent police contacts or are high risk in the community. In Portland, we have at the bare minimum the crisis line, which does now, BOEC can now transfer to the crisis line if someone, if they deem that someone's not meeting that bar for the police, and then Project Respond can be sent. Sometimes they do come with police, Project Respond that is, who are two mental health clinicians. But a lot of times, and I know that they're really making an effort now to, if at all possible, respond without police for all of the reasons that you've all mentioned. And we work closely with them, so we have relationships. So when we're needed, or they need us, or we need them, obviously we have that working relationship. Officers can also call them out when they recognize that this is just a more complex issue that maybe at its core is a mental health challenge, which is not our expertise, obviously. So we can call out mental health clinicians. Sometimes we have to stay, sometimes we're able to leave and just pass that off. And then obviously in the behavioral health unit, we have our officers and mental health clinicians that officers can refer to us, which there is still a police officer involved. But in my experience in the 3 years I did that, we can very frequently overcome whatever barriers they are and really kind of build trust and relationship, because at some point people may need the police, and having an interaction with me or one of the officers in our unit that's positive, where we're there and they see that we're just there to help and to help them meet whatever goals they want to meet, really I found is a restorative and helpful thing for people. So we do have kind of a model of that response where it's not all cops for every mental health call in the city. But certainly there can be improvements. And I love the idea of giving families and people supports early on and that early intervention, because I would love to see people get what they need before they get to the point where they're in crisis and even need to call the police, right? It's not even that serious. That would be awesome. So yeah, I agree with all that. That was a lot of information at once, but I just want to at least put it out there that some of that is in place. It's not, just cops for every mental health call that 911 gets, but not to say that there's not a lot of improvement that could be made either.
I just want to jump in and echo everything Chase said, because I think it's spot on. From the Department of Justice's perspective, we found extraordinarily good value from the behavioral health response teams that Chase is a member of and the service coordination team. And while we were disappointed that the city cut the budget, so the Bureau ended up cutting the behavioral health response teams from 4 to 3, I think that is a place where this committee could make recommendations if it thought that these teams provided unique value that is worth, investing in more. That's something that I think would be a worthwhile, recommendation. I know you've heard from the service coordination team. I know you've heard from the behavioral health response teams and ECIT officers. After you've done the education piece, I think there is a loop closing, on determining or at least considering whether there's a recommendation to be made based on what you've heard. And, that's obviously up for you all to decide. But, and thinking back to the original question that Tia asked or Amy on what your goals are, to me, that is part of the process. You learn what the Bureau does, how it engages the community in different segments of the community, and then you make recommendations based on what you've learned. And so I think this is a fertile ground for you guys to explore further.
Wow, that sounds wonderful. We definitely have a lot of interesting questions and ideas, and definitely something we need to really look into as far as what could be made available. Now, the earlier question about merging PBB with the Portland Street Response, I think there's separate funding in there available, so it kind of made the pilot a little bit different project. But there's more can be. If you want to know more about that, feel free to ask Barb. She's an expert at it, so she can give you some details. Next on if no one else has any more thoughts or ideas, Jared, thank you. That was like incredible information. Wow, that was really good. So the next agenda item would be looking at creating our mission statement. So Claudia, did you bring a copy of the racial equities mission statement so folks can get an idea of what we're kind of looking to do? Or not?
She did. Claudia, are you there? Claudia had to switch to her phone at one point. I am looking because she put it in the hotline, in the box for me before she left.
Oh, hey, Judith, I'm here. I can get that for
Oh,
you.
okay. Sorry.
It's okay. No problem.
A lot of going back.
So I'm going to go ahead and paste the racial equity subcommittee mission in the chat for anyone that would like to see it. And then I can also read it. All right, you guys ready for me to read it?
Please, that would be helpful.
All right, great. So yeah, this is the Racial Equity Subcommittee mission statement that they put together a while back. It's the mission of the Racial Equity Subcommittee is to advance racial equity by giving voice to families of color and of low-income socioeconomic backgrounds by identifying areas of discrimination that require change, trust, and the embedding of equity in various capacities.
Thank you, Claudia. Well, that was it definitely grabbed my attention, and I thought it was extremely important that the Behavioral Health Subcommittee have a stance that we stand on to the community. And so I was looking to get everyone's help on what you think should go in it, or what do you think would sound good that represents our work here. And that could be anybody. So what does anybody think? What are your ideas? Come on, help me out.
I see in the chat, Byron says he likes it.
I'm sorry, are we trying to copy or get as close as possible to the Racial Equity Subcommittee for the Behavioral Subcommittee?
No,
Okay, so that's just an example.
sorry.
Okay,
I was basically looking at what would represent our community written in a way that the racial equity community wrote their message to represent their group. It was just an example. I work with visual. Okay, if I see something, it's a little easier for me to come up with an idea. No, we're not copying it, but we want to create something that spells out the work we're doing in the Behavioral Health Subcommittee. So I would want words like educates, we educate folks. We bring the voice of the community to the table on issues of mental health and substance use, or behavioral health and substance use disorders. So that's just kind of my examples, but what comes to you guys' minds? I'm looking for input, if it's possible.
I am better at writing out a mission statement. I can continue to throw out sentences, but it's hard for me to think of a whole mission statement verbally.
Right. No, I get that. And whatever you have and however you do it is greatly appreciated. If you're better writing it down, then write it down and we'll further. This is not the end of it. We're just beginning, to come up with something, because I want everyone in the room who participates in this committee to feel like you're a part of this. I want everyone included. I don't want it just to be me. I'm all about inclusion. That's another word I like. I like including everybody's voice. And since we're all going to be doing the work, well, anybody else?
Our mission is to our mission is to have a goal to. Wow, I got stuck. I'm sorry.
The mission of the Behavioral Health.
I will just share with you guys, with the Racial Equity Subcommittee, it took them a few times to really get this mission statement put together. It took a few meetings in person before COVID happened to really sit down and think about what their mission is as a subcommittee and as PCCEP. So, you know, it might take a few different statements to get to the one you guys really feel is meant for the subcommittee. So please don't feel rushed tonight to get it.
Right,
done.
that's what I was saying a minute ago. I'm gathering input, you know, that we'll work on over the course of time. I just want to get one written, that's all.
Yeah, this is exciting.
Jared, do you have any ideas?
Yeah, I mean, just from what I was talking about tonight, to stay on topic, you know, I think something that includes the goal of decreasing law enforcement contacts with people in a mental health crisis and improving the outcomes of those encounters when they have to happen.
Perfect. Judith, who's taking notes tonight?
Claudia is right now.
Yeah, I'm
Okay.
taking the notes.
Great.
I'll go back and listen to the program.
Then we'll have the ideas on paper as we try to, and Byron, was there something you wanted to add? Even if it was a few words or a statement, I'm good.
Jared took the words out of my mouth.
Oh.
Yeah. I was gonna say you did a good job. I like that.
Okay. How about to reduce the number of unnecessary, what do you want to say, fatal outcomes? Maybe that's a better term than shootings or killings. I don't know.
Police contact.
Police, well, with fatal
No,
outcomes.
Oh,
I thought it was excessive force of use.
Use of force.
Excessive
Good
use of force?
Yeah,
Yeah,
sorry.
we can, that's okay, it's
The
fine.
force
We can
of use.
reduce excessive use of force. We can
Yeah.
put that in there. Absolutely.
Just any injury or any force.
Yes.
And
Okay.
the-
I've heard over
The re-
time, I've heard you all talk about building trust. I just wanted to end relationships. So I just want to throw that out for you.
Well, how about we leave the word trust out for now and let's get, create stronger communication and relationships. That would be my thinking.
to bring structure to the mental community.
There you go.
Got to have structure.
Okay, can you say more about that, Byron? To have who bring it to the
Oh,
community?
to bring more structure to the mental health community.
Is that to the delivery service of services, or do you mean?
Yes, because that's what we're eventually going to have. Hopefully, the person will have is structure once we're done with them, you know,
Gotcha.
and handling their mental health. Because we want them to be so overwhelmed with courage. I know that's a pipe dream, yet, you know, it's a bar that's set.
It's okay. I live with bringing everybody hope, and not everybody believes in that. So we're on the same page. Well, that's a good place to start. I think having a few ideas is excellent, and we'll work towards this. You guys can think about it. Chase, do you have any thoughts on what you think would make a good mission statement, or anyone else on the Zoom meeting?
I don't have any like full-on things. The only thing I can think of are themes from all the meetings I've been to.
Okay.
Talked about a lot is like preventive stuff, right? To just head things off. So I don't know if that's increasing or advocating for systems to support people before it becomes a crisis.
Oh, that's good.
And then the other thing that I heard, and you kind of mentioned it, but to me, it's more of a frame of mindset than anything, is you guys talk a lot about building relationship with the police bureau, and I value that as well. And so I view it kind of as a partnership, because
yes,
we also don't want those outcomes. And so somehow, you know, I feel like we all have the same goal, and working together to get there is what this committee is about, in my view, from the outside.
Excellent. Very true, very true. Well, okay, that was good. Got our brains working, and it's 7:15. We're happening. Okay, so now we're going to get to the section of, does anyone from the public who's not a PCCEP member want to provide input on anything we talked about tonight? Nope. Okay, well, if there's no takers, then we have a few minutes left, but I'm always welcome to give it back to everyone. I know everyone's tired. We are planning to have guests from the wellness program in October. They're going to be out of the, what's it called?
It's the Employee Assistance Program that we're planning to hear from in
EAP.
October.
Yeah.
Hold on, let me finish. And previously, last month, we heard from the wellness program from Officer Leo Harris. So I invite people to check that out so they have that background, because my hope, I don't know, is that we can write up some recommendations in the next month or so after that around the wellness program and the employee assistance program. So yeah, that's where the best info is going to be, on YouTube.
Excellent. Well, that is our upcoming, Byron, since you're new and T is new, is there anything you'd like to have on an agenda to like learn about, talk about, work with? We have a whole lot of folks here happy to support us, and you're a new member on our team, and we want to give you a chance to request some ideas, things you'd like to talk about or hear.
I'll just say that I really love connections. So I hope to help connect people I know to people you know, and work together as a community. And I'm hoping to learn from everyone here who their connections are so that I can make this big circle.
Excellent. Network partners, yes. Byron, any thoughts about future meeting agenda items?
No, hearing more from Chase and Jared, if I'm pretty sure if they're PPB, and just, I guess I want to know, knowing my restrictions, and so I know what I'm working with still, because I'm still kind of fuzzy on some things, but yeah, that'll probably be the next year. What's how far can I go with this?
What do you mean?
Oh, implementing, language, implementing rules, because
Paul and Mary Claire.
Okay, there's an individual who entered our room, Mary Claire, who happens to work at the top with the police department. There are so many ways to provide input. I know it's kind of like one note, Mary Claire, but can you kind of give Byron, our new member, some ideas on some of the places he could be working on language or working on, recreating thoughts about how things work? I know one is the directives. That's one area that we're responsible for, the PBB directives. That'll take you forever. Are there any other places, Mary Claire, that he could be reading and advocating and writing for change now that he wants to?
Let me think. Well, yeah, the policy certainly is, the input is very valued in terms of, what governs the Bureau's actions. But in terms of language, any of those ideas, we can certainly, take any of your suggestions. I didn't know whether, Barb, you were saying that that's the dispatchers, and obviously that isn't the Bureau if you're listening to BOEC, but clearly this committee can make recommendations towards the BOEC system as well. But you're right, I think, we have made great strides in trying to change the way, we refer to persons with mental illness in the Bureau. We got rid of the 1234. they often talked in, and I don't think, over the years it was intentional to dehumanize, but it obviously comes across that way. I have to tell you that the Bureau codes everything, car prowl is a 666, whatever. I mean, and
Yeah, it's all
Chase,
number-
yeah, Chase can talk to that. So, but when it's brought, to the Bureau's attention, we certainly, acknowledge that and tried to make those changes. Any ideas like that, we're certainly, open to, hearing, and, we can take them to whatever part of the Bureau it relates to. There's obviously training area. We do have a training advisory council, but you certainly are welcome to, make recommendations, in the area regarding training, if you have some, particularly with regard to the, how persons with actual or perceived mental illness are treated, and those kind of things. So training, I think, is another area where input would be, welcome. I'm trying to think of other.
And would that information be best found at the website, at PVB's website, or at the Police Bureau's website?
At
PCCEP, sorry, my mind. Right?
The PPB's website will have, I think the Training Advisory Council has, a section on the website as well. But if that's hard to navigate, you certainly can let us know, and we can hook you up with the right, connect you with the right person in the Bureau to work with on some of that.
Yeah,
there is a TAC meeting, frankly, tomorrow evening. So.
Oh, there you go. Does that help?
And we are trying to, put a calendar together on the website that will have all the various PPB Advisory Council meetings scheduled for a month. So there's a calendar.
That'd be awesome. Yeah.
So that's up there now too.
Yay. Does that help, Byron? Answer your questions? There's a ton of places that you are able, and as a member of PCCEP, you have your own email address. Do you have one yet? PCCEP email address? Because if not, if you do, then you can use that to convey any ideas you have to Claudia, and she will, distribute them out to us. If there's anything you want to talk about, anything you want to say, you have basically an open mic. And then we can direct you where best to, put that information. So everything here is open. It's just there's a lot available, and it takes a little while to get under your belt. So don't worry, I'm still working on it. But
maybe can I just answer a question? I saw Barb's in the chat. The reason it's not on there, is Judith referenced, the PCCEP is not in, a Bureau Advisory Council. It is the mayor's, which is the reason why it's not listed on ours. You are actually an advisory council to the mayor. And the ones on our website are the ones that, are formulated, and sort of staffed by the Police Bureau. So that would include the Muslim, Advisory Council, the, Slavic Council, all, the 7, 8, I think we got probably 8, 9 or 10 now. We just began a Pan-Asian one too. So there's a lot of different advisory councils.
Well, there we go. Perfect. Thank you. Yes, there's so much available, so much work to do, and so much we have done. So don't get worried, everybody. It goes slow because there's a lot to do. Are there any directives, Mary Claire, that are coming up that we need to attend to that you could speak of?
I'm trying to think I don't know that there's anything posted right now. We just took the ABLE policy down, and we're hoping to get that enacted shortly, as the Bureau is going to be training on that in October, which is the active bystandership in law enforcement.
Oh,
And yeah, so
that sounds
that's-
interesting.
yeah, it's, you know, sort of to try to reduce the harm that can be caused by, it's not so much, telling on each other, but for each to look out for each other so that, try to avoid, harm to officers or to their careers or to other people, to be honest with you. So we got that going. And I
Hey,
don't
Mary
think,
Claire, when
yeah.
does the 850-20 come up?
Not for a while. I think, I'm trying to think, when did we last do that? We might have done it in the spring, so I'm guessing it'll be, I'd have to look, Jared, but I think, I think it was probably early spring. So, and that's an annual review. So, but I can find that out for the committee, because there's a suite, obviously, of those.
And if it took the committee a couple of months to look through that, then maybe getting a head start for them wouldn't be a terrible idea.
No, actually, it's
knowing
probably.
the comments aren't going to come until the spring or later, or whenever they come up. But just so the committee knows, that's the directive that governs response to mental health crisis.
Yeah, and you could take those up at any time. I do want to say, you don't have to wait until it's posted. In fact, the complaint has always been that that's not enough time for councils to look at it. So I would urge you, if there are particular policies that are of interest to this committee, and clearly, those four would certainly be, you could take them up at any time, even if it's not posted, and you could send the comments in. We hold them until it comes to review, and then we would, come back to you and talk to you about it and get, further input. And that would actually, I think, be more advantageous, because when it's posted the first time, it's a 15-day review of an existing policy, and then you get 30 days once we have developed the policy and we're ready to say that that's the our final version. The first one that's posted is the current version, asking people if they want to offer any changes. And then we take those comments, we work internally with subject matter experts and what have you, come up with what we think is the proposed final draft. And that goes up on our website for the public comment on our draft of a proposed final. And then once we get more comments out after that second, we take it down and add additional edits based on those comments received. And then, it goes for final approval, both, through DOJ and ultimately the chief's office. So.
And I'll just say that's a long process that's, hard to follow sometimes, but I heard the long and short of it is, if you make comments in advance, they'll hold them and then consider them. And the reason I referenced the 850.20 is because, there was a public misunderstanding. That policy requires 911 to dispatch police officers to call, ECIT officers in particular, to calls involving suicide and a mental health crisis, which it naturally, is going to be on a suicide call. And some people in the community want Portland Street Response to be dispatched to those types of calls. And I'll just say, it is not a Department of Justice directive that suicide calls have to go to an armed police response, ECIT or otherwise. And to the extent this committee wants to consider whether some of those calls are more appropriate for something like Portland Street Response rather than ECIT officers, who are, available 70% of the time. That's something I think this committee should consider, as you think about 850.20 and the mission to sort of, decrease law enforcement interactions and increase positive outcomes or decrease tragic outcomes. That might be something for you to consider.
And, I don't want to get into a legal fight with Jared here, but the city attorney and our office, has a little different idea of that, as part of our developing our mental health response. we had to develop certain criteria of calls that ECIT would, and DOJ did in fact, sign off saying that that were the criteria that we had to respond to. But I think there is, certainly room, and we're going to meet with street response in a couple of weeks to talk about this. Clearly, in situations where people are armed with weapons or guns, those are situations that you wouldn't, necessarily let a, civilian, go tackle it, because they're pretty dangerous situations. But there are certain, obviously, other suicide calls that we've actually, talked to street response about, that BOEC gets, that they refer to the crisis line, and there's nothing to, stop them from responding to those calls or asking BOEC to maybe, refer them those calls as well. So there's.
And Mary Claire, I do need to just correct one thing. I mean, the city and the Bureau proposed a policy and we approved it, but we never dictated that these calls have to be the ECIT calls.
Well,
that is a prerogative of the city. And I understand the city has good reasons for dispatching an armed police response to a call involving a weapon. I understand.
Yeah, no, I'm not talking about our policy. I'm talking about, and it was prior to your coming onto the case, but we had to propose the Portland's response to mental health crisis. It was sent to DOJ, and we have a letter from DOJ saying we had to follow that process in order to be considered a Memphis, to meet the Memphis model. So that's what I'm referring to, is not our policy, but the fact that the settlement agreement required us to be a Memphis. We were always a hybrid. We were from the get-go, but for whatever reason, the terms of the settlement agreement used the word Memphis. So we were required to propose a system of response. And
I was very involved in that, and we never required
yes,
police response
Adrian Brown
to every
did.
suicide call. That's absolutely not true.
No,
and
not
if
every.
it ever were true, we corrected it.
No, it was. I'm not saying every, Jared. What I'm saying is that for ones that are armed, that have the present ability to, that have opportunity and the means to, I believe is how BOEC has it, has the means to, fulfill that. It's one of the criteria that was approved by DOJ for the.
Yes, we approved it, but we did not require it. And so what I'm saying is that you are free to amend that as a city, and we will consider it. And it would likely be approved even if you took out suicide calls.
Yeah, well, we'll see. Yeah, we have to work on that.
And that's going to be the city's call.
Wow, that was deep. Okay. Woo. Well, looks like we got lots of work to do.
I have a,
Bob.
Amy, I had a suggestion just to see if it sticks. In a situation like this, when a mental health is called for something like that, I know it's already in the law, but can we write something in the language where if a mental person have a gun, it's not a crime in a sense, if that makes sense. You know what I'm saying? We're not bringing the cavalry to go help with some mental person because he has a gun. That mental person doesn't necessarily understand why he has a gun. He just knows this gun is going to cause damage.
And nowadays, it doesn't even have to be real.
Well, that's what I'm saying. So, without the police being called, even though this mental person has a gun, you can send a team of 5 people to deal with this guy that has a gun that's a mental problem. And have the people that are going there, they can have some type of authority to call the police again, or they can make a civil arrest by just bringing the guy in, without any incident or anything like that. You know what I mean? This guy would probably just give up himself willingly.
Yeah.
Sorry.
I was going to say the only variable to all of this with guns is if they happen to be on parole or probation, it's prohibited for them to have a gun in their possession or be around anyone who has a gun. So there's legal ramifications based on the very stance of where they are within, you know, the criminal justice standings. That's a whole nother layer.
And,
that has to be
and I
added.
would remind folks that you also should understand that those calls aren't always identified as a person with a mental illness. Well, you know,
right.
the one in the park was dispatched as a man brandishing a gun in a park.
Right.
Nobody knew prior to going that this person, was, perceived to have a mental illness. That was the call out of Bowick. So a lot of times you don't know till you get there whether in fact there is a mental health component to a call.
Well, maybe we ought to assume that anyone pulling a gun is already tripping.
Well,
okay? You can't be in your right mind and pull a gun on someone, in my mind. So I don't know. Maybe we ought to just consider that an option.
So, and Amy, Byron, in the group, we've talked about the language that we commonly use is someone having a behavioral health crisis or a person in crisis, as opposed to, a mental person or someone who is mentally ill. So we'll have more of these conversations, as I'm sure, but that's one of the things that we have gotten clear on.
Okay.
There's a sensitivity to the nuance of the issue. Yes.
If I can just speak generally to that, like the police bureau's training would say, if someone's calling in, say, alone in their house, feeling suicidal and has a gun, we certainly are not going to treat that as a criminal thing. Our training would say this is a mental health crisis, and our officers would hopefully recognize that. And in fact, we've given a training recently to speak to how do we lessen the likelihood that if this person does want possibly to use police as the means of suicide or such, how can we lessen that likelihood? And so if they're not a danger to others, that's our main assessment, right? Is there a danger to a third party? And if so, we have some duty to, try something. If they're not a danger to a third party, our training would say we come up with a different plan, whether that's, try to get follow-up from the behavioral health unit, the mental health clinician, or whatever that looks like. So certainly our training, and a lot of times we won't even address, certain crimes, recognize that, hey, what's undergirding this issue is crisis. And let's address the crisis, especially if that's driving some sort of, criminality. And so, I'm not speaking specific circumstances. Certainly people could come up with specific circumstances that they feel were handled differently, but our training would say, we're generally addressing crisis and we're not rushing into a circumstance where someone's in crisis with a weapon if we don't have to. In fact, we try to slow those down as much as possible, recognizing the possibility for, a violent or fatal encounter, which is the absolute last thing anyone wants. Police officers, community, of course, that person and their friends and family.
Well, that was a lot. And it looks like everyone, we've kind of gone over our meeting time, but thank you all for coming. And we're not going to stop these conversations. We're going to keep having them and keep learning. And thank you, Chase, and everyone from the city who came, because it really helps us to show folks, well, first of all, listening to everyone, I now realize how much I have learned in the last few months. So this is awesome. So the more new people we keep adding on board, we have to maybe find ways to help them navigate where we've already come from, because this gets kind of hard to track because we've been doing it for so long. But Byron, thank you for all of your comments and thoughts and questions. And Tia, thank you. And so I'm going to call this an evening unless there's anyone else who has anything to say. No final notes from the peanut gallery?
Thank you. Have fun at the soccer game.